Hello everyone, here's our IDU project of skin cancer made by Kevin, Tingzhu, and Ziqi.
Skin cancer is a non-communicable disease which occurred in epidermis, the outermost most skin layer caused by unrepaired DNA damage that triggers mutations. These mutations leads the skin cells to multiply rapidly and form malignant tumors. The main cause of skin cancer is overexposure to sunlight, especially when it causes sunburn or blistering. UV light would damage the DNA in your skin and cause abnormal cell form. This abnormal cell form will be separate and form into cancer cells. The other cause of skin cancer is often in touch with some chemicals such as tar and coal, while the symptoms are fresh color or pearly bumps that appears on the body that never goes away. Of this, melanoma is the deadliest type of skin cancer, killing nearly 9,000 people each year. Although the overall incidence of melanoma is highest in older adults, it is the third most common cancer among adolescents from 15 to 39 years old.
Australia is a highly developed and modern country which is located in Oceania and bordering the Indian Ocean and the Southern Pacific Ocean. Australia covers an area of 7.692 million square kilometers, ranking 6th in the world. The government system in Australia is a federal parliamentary democracy like most of the countries in the world. The main industry in Australia is the service industry. Australia near the equator and with a predominantly white population, not exposed to high levels of light, has the highest incidence of skin cancer. Australia has an average population density of 3.4 persons per square kilometers of total land area, which makes it one of the most sparsely populated countries in the world. The study found that household wealth in Australia is very unequally divided. According to Cancer Australia, in 2018, melanoma of the skin was the fourth most commonly diagnosed cancer in Australia. It is estimated that it will become the third most commonly diagnosed cancer in 2022. In 2022, it is estimated that 17,756 new cases of melanoma of the skin will be diagnosed in Australia, among 10,374 males and 7,382 females. We are going to look at the social, economic, and political impact of skin cancer in Australia. We are also going to talk about the science of the treatment and the positive and negative impact of the treatment on the same three factors above.
According to the data, skin cancer will become the 11th most common disease in the world. The reason for the high incidence of skin cancer in Australia is because of the climate. There are many people of white skin in Australia that are not suitable for the harsh weather. Australia is more keen on outdoor sports. In 2013 to 2014, 23,437 people in Australia had melanoma and were hospitalized. A 63% increase from 14,348 in 2002 to 2003. Furthermore, the age standardized incidence of melanoma has increased from 27 per 100,000 in 1982 to 49 per 100,000 in 2016.
In Australia, the cost burden of treating melanoma has increased from an estimated $30 million in 2001 to $272 million in 2017. In 2015 to 16, medication cost the Australian government $92.3 million for an estimated 1,100 new annual cases of advanced melanoma. The mean cost of treatment per patient with melanoma has increased from $10,716 to an estimated mean cost of $14,606 3 years after diagnosis. It costs the Australian health economy $1.7 billion each year. With skin cancer becoming more prevalent in Australia, the Australian government has implemented a series of measures and funding to build a prevention and treatment system since 1980. Due to Australia's sparsely populated situation and the high gap between rich and poor, Australia's Gini index is 34. People at the bottom or people in remote areas are more vulnerable to skin cancer. Most of them are unable to pay expensive fees and do not have private health insurance, which has led to an increase in mortality and infection rates among such people. This is not conducive to the stability of the society, especially for Australia, that is a sparsely populated country. Some parts may have a chance so dissatisfied with the government to produce, even as others disgruntled of late insurgency. This will pose a threat to the government's rule. At the same time, it also gave the opposition a chance to who hearts and minds, especially huge bottom and middle residents, in order to challenge the ruling party in the future.
Chemotherapy drugs work in many mechanisms, but their combined effect is to slow or stop the growth of cancer cells, which are known to divide and proliferate rapidly. It comes to the form of pill, liquid, or tablet that people can swallow or put under the tongue to dissolve. Injection, which are also very common these days, are mainly subcutaneous injection of the drug into the muscles of the patient's arms, thighs, or buttocks, or the fatty areas of the arms, legs, or abdomen. Dagabazine is the most suitable chemotherapy drug for melanoma and the only FDA-approved melanoma chemotherapy drug that can also be intervened with combination chemotherapy. Combination chemotherapy involves the use of 2 or more anti-cancer drugs. This is a common approach in cancer treatment because it may be more effective than single-agent chemotherapy. Regimens for some cancers are though effective but may increase the impact of side effects and drug interactions.
The main initial treatment for melanoma is surgery. The early-stage melanomas can be removed by minor surgery under local anesthetic that cut off the tumor and some normal skin tissue around it. A wide area of healthy skin around the edge of the tumor is removed to ensure that no cancer cell were left behind. This minor surgery will leave a scar if the lymph nodes in the area have been affected by the melanoma. They are often removed surgically while under general anesthetic. This is called lymph node dissection. Also, it might increase survival time and prevent the discomfort brought on by the disease spreading to the lymph node. It won't necessarily treat the malignant tumor. The removal of lymph nodes from the arms or legs can have adverse consequences, one of which is an accumulation of fluid in the limbs.
Targeted therapies target specific types of skin cancer that are important in preventing and slowing the spread of advanced skin cancer. Targeted therapy works by finding a specific substance and attacking it to destroy the substance in the cancer cell. Targeted therapy can target the substance that determines the growth and genetic changes of the cancer cell. We use targeted therapy after surgery to help prevent cancer recurrence. Through several studies, scientists have identified a lot of molecular pathways and mutated genes involved in skin cancer, such as BRAF and NARS, for which targeted therapy is highly effective in patients with these mutations, which plays a critical role in cancer cell survival and reproduction. The Australian government takes skin cancer treatment seriously. In 2016 to 18, more than $250 million was awarded to 589 individual cancer research projects, with $187 million of that from the Australian government. This has helped boost the popularity of the Australian government and put a positive spin on skin cancer treatment in the minds of the public. At the same time, thanks to Australia's excellent health system and government investment, skin cancer survival rates are kept at a fairly high level. In 2020, the age standardized mortality rate was 4.3 deaths per 100,000 persons. In 2020, it is estimated that the age-standardized mortality rate will be 3.7 deaths per 100,000 persons. So Australia is making a huge contribution to the global treatment of skin cancer, which reinforced its international ways. Targeted therapies are often expensive, but the effectiveness in critically ill patients is limited. In Australia, the main first-year cost of melanoma per patient ranges from $644 for melanoma in situ to $100,725 for unresectable stage 3 or 4 disease. The prolongation in median overall survival was only 2.16 months. Of the 12 anti-cancer drugs approved by the FDA in 2012 alone, only 3 prolonged survival, 2 of them by less than 2 months. Yet 9 were priced at more than 10,000 per month. Therefore, more and more severe cancer groups and their relatives began to put pressure on the government, which also led to the implementation of some medical bills in some areas, resulting in a vicious circle. The Australian government should pay more attention to the cancer groups and take measures to reduce the political adverse impact.
For an excision plus a sentinel node biopsy, the patient's out-of-pocket cost would be $652. For the excision alone, it would be $79. With most micrographic surgery, the treatment cost averaged roughly $4,366. The average cost for excision was just under $4,700. These are the approximate price for doing a skin cancer surgery each time. Standing at the perspective of a hospital, these bills that pay for the surgery is the income for the hospital. Then the economy of the hospital is improving so that they can use the income to improve the healthcare system, medical equipment, and facilities. However, the surgery fee also has a negative impact. According to the same data above, standing from the perspective of the patient, the payment of surgery will become a burden. Expenditure for ongoing and expensive treatment for surgery, and lost income off working time combine to create a financial burden. This burden could be a disaster to some people. It can lead to drained saving, borrowing money from others, and selling assets for the cost of treatment. The financial toll can be a source of anxiety and stress for both patients and caregivers in this difficult time. Caregiving may also reduce a person's chance of being employed and unable to.
Skin cancer are common in Australia and also cause many deaths, with 1,281 expected to die by 2022. According to the figures, chemotherapy can stop the growth of cancer cells, which means that it can prolong the patient's life. For patients with melanoma, chemotherapy usually selects until the 4th stage. Skin cancer has a high survival rate relative to other cancers. An individual diagnosed with melanoma are 90% likely to survive for at least 5 years. It's significantly higher than the 5-year survival rate of 67% for all cancers. So the average patient reaches the fourth stage. When it spreads throughout the body, the effect of chemotherapy can improve the survival time of patients. Many people experience anxiety and depression after chemotherapy treatment, which is normal after chemotherapy and may subside over time. Many people have difficulty controlling their emotions after chemotherapy because it's very difficult to return to normal life immediately after chemotherapy. Although chemotherapy can stop the rapid growth of cancer cells, it can also damage those healthy cells. Feeling very weak after chemotherapy and recovery, this will greatly reduce people's quality of life.
Australia has the highest incidence rate of skin cancer in the world. This terrible disease has taken the lives of countless people and affected every aspect of the country and the world. With the active response of society, government, and individuals, we believe that we will solve this problem in the near future.